Now go back and participate. We can stop it.
Good evening. My name is Lori Weigelt. I'm a Senior Marketing Manager at miraDry Labs. Please allow me to welcome everyone to the miraDry web seminar entitled Growing Your Practice, No Sweat. At this time, all phone lines have been muted to avoid disruption and background noise. Time has been allocated after the presentation for a Q&A session with our speaker, so we welcome your questions at the end of the presentation. You may submit your questions in writing throughout the presentation by typing them in the chat box on the top of your screen. We will try to answer all questions submitted during the Q&A time. Now I would like to introduce our guest speaker, Dr. Christopher Khorsandi. Dr. Khorsandi is a board-certified plastic surgeon and the president of the Las Vegas Plastic Surgery Society. He is a founder of VIP Plastic Surgery in Las Vegas, Nevada, and offices in Beverly Hills, California. He is trained at top medical institutions, including Temple University, UPenn, and plastic surgery residency at Cleveland Clinic. Dr. Khorsandi has been honored as a passionate and skilled physician through numerous patient choice awards. Tonight, Dr. Khorsandi will be presenting his experience with the miraDry procedure at his practice. Dr. Khorsandi, I'd like to now turn the presentation over to you.
Thank you, Lori, and it's a pleasure to be here. Thank you for joining us to learn about the miraDry procedure, something that I strongly believe in and have incorporated in my practice in a niche sort of market that I believe is growing every single day. So what miraDry is a non-invasive treatment for permanent reduction of underarm sweat and odor. In fact, it's the first type of device that has been FDA approved for such a purpose. And I initially joined the miraDry family and was one of the first adopters of the technology because I believe that there was an unmet need within the market. I have a hand surgery background as well, and some of my patients come to me for hyperhidrosis, but I also have a large cosmetic practice in which we see patients concerned about these issues. The way I looked about sweat, I looked at it in the same way that we looked at hair removal 20 years ago, tattoo removal, and things that have grown into industries, and I believe that sweat is the next frontier. What my experience with miraDry is that it is an extremely high patient satisfaction treatment. It has a high efficacy, a great ROI, and great clinical data to support it. So usually when we look at what devices to buy for our practice, we really want to know, does it work? And that was one of the key things about miraDry that I really liked when I looked at the numbers. In fact, when we look at some of the satisfaction surveys, some of the websites such as realself.com, miraDry has one of the highest patient satisfaction ratings of any device out there. And I think that speaks to the level of improvement that patients experience with the treatment in their life and the quality of life that they can gain from having a treatment. So why miraDry? Consistent results. Our patients, over 90%, have excellent results. It's an easy conversion. Most of my patients come in, they're already miraDry ready candidates. Very little consultation is needed. Patients have basically tried everything, and if a hyperhidrosis patient walks in the door, there is almost a 75 to 90% conversion to miraDry in that setting, and almost 95% within the second, consultation. So I don't have too many procedures like that where patients will come in and already know and already be pre-qualified. The patients are well educated, and I think the reason for that is because there's so much high patient satisfaction out there that they read about experiences on sites like Yelp and RealSelf, and they say, okay, there is efficacy here, and this is what they want. Hyperhidrosis patients will tell you that underarm sweat is probably their biggest problem in life. But in terms of surveying the general population, people consider underarm sweat to be more onerous than being overweight, having acne, having a cold sore, or dandruff. So as a society, we look at these things and we don't realize how much these impact us. And yet, all you have to do is walk into any local Target or Walgreens or CVS and go to the deodorant aisle and see how big that aisle actually is. Deodorants, antiperspirants, they're a multi-billion-dollar industry, and they're one of the few cosmetics that almost everybody wears every single day without really thinking about it. It's part of our daily routine. The reason for that is that we've been trained to believe that, underarm sweat is unattractive, and it actually, this odor can be offensive. So we know this to be true. So when we look at treatments, we like to have treatments that have a good market, a broad market. We don't want to be too niche, because when we're too niche, then patients, are hard to find. With miraDry, they're not that hard to find. The technology that we work in is the electromagnetic spectrum. It's a relatively unexplored slice of the spectrum. It's microwave technology. Now, lasers function on visible wavelengths, infrared wavelengths, RF, but miraDry operates on microwaves, which have been well established, the physics of which we have explored extensively in the scientific literature over the past 60 years. So microwaves work by heating water, and the energy is absorbed by the electric dipoles of water, almost like, if you can imagine, when you start a campfire with a bow and a stick, and you rub that stick back and forth until friction occurs within a groove, and it starts heat. Well, the water works in the same way. When those two electric dipoles work against each other, they create heat and friction. And this is the same sort of physics phenomenon that heats our meals and will also work within this technology. And so what we're doing is we're trying to heat a specific target tissue, which are the sweat glands. And thankfully, they're full of water. So the technology is really well tuned to what its target is. So we want to treat sweat. We found the right part of the electromagnetic spectrum to do so. So if we look at this diagram here, we see the miraDry system. We see at the top here, we see the device area where it's being applied to the skin. And we see the waves of energy being treated, passing through the epidermal elements down to the bottom of the dermis into the area in which the sweat glands reside. And we can see that at the dermal fat junction right here. And we have both abocrine and eccrine sweat glands that occur in this area. And what we see is when the energy hits that area, it gets reflected right back, creating a zone of increased energy right at the base of the dermal fat junction where all the glands reside. So we focus the energy in the area and we use the right wavelength of energy for the target tissue, thus creating extremely high efficacy. So what we are doing down here is we're heating to destroy the glands in this area, and then the miraDry tip provides a cooling zone to the dermis and epidermis to prevent dermal injury. So cellular thermolysis occurs at around 60 degrees centigrade, and what we do to prevent any sort of untoward complications is we cool the dermis in that area. So moving on, we see that these are ideal ways of treating sweat glands, and we get maximum destruction of the sweat gland network. It's a non-invasive way of doing so. In patients that have hidradenitis suppurativa, we will often excise the glands, and this is a non-invasive way of treating the glands. We basically deliver energy through the dermis into the glandular tissue and destroy them. The efficacy is extremely high. If we look at the histological specimens here, we see sweat glands here, and we look at 10 days post-treatment, we see a destruction of that glandular tissue, and 180 days post-treatment, that same zone, the glandular tissue, is no longer there. So we know that there's durability because there's no ontogenesis of sweat glands beyond the embryonic period. So what we have at birth is what we'll live with for the rest of our lives, and what we remove will be removed for good. And so we look at a starch iodine test here, and this is a very simple test. We probably did this in grade school for a science fair, but if you put iodine on the skin and sprinkle regular Arco cornstarch that you would get from your supermarket, anywhere where that iodine is wet will turn black. And so the way you do a starch iodine test is you paint some betadine onto the skin, allow it to dry, put your cornstarch on there, and watch where people sweat. And it's a good way of finding areas of sweat for patients. And you can see this is an axilla. The patient that was treated, and at 3 months, there's no perspiration in that area. And obviously, the area that was treated was within that box right in here. And we can see at 2 years, that same area, there's no return of sweat within the box, but outside of the area of treatment, there is sweat production. And at 3 years, we see the same thing. This area within the box is sweat-free. So durable results. These are the things that patients like. So we have a couple of efficacy studies, 2 sites in Canada, 24-month follow-up. And they use 4 different actually efficacy measures. The HCSS scale, gravimetric, which is basically weighing cotton balls that have been soaked underneath the underarm, patient satisfaction surveys, and the DLQI, which is the Dermatology Life Quality Index. And so with these 4 efficacy measures, we saw improvement over the duration of that 24 months. And we can see it here. It's pretty, cut and dry, no pun intended. The average sweat reduction in these patients is somewhere around 80% at 12 months. The satisfaction rate is nearly 100% at 12 months, which is, in my books, that's one of the most telling factors of why this works so well, why there's such high, patient word of mouth. Patients who have hyperhidrosis, when they're happy about a procedure, will tell their friends. It's one of those things that there's really very little embarrassment about when you tell people, I actually had something that changed my life. The efficacy studies based on the Dermatology Life Quality Index, when you have a 5-point drop, it means a clinically meaningful change. And on average, patients went from 11.8 down to a 2. At the end of 24 months, we see a 1.3 average DLQI score, which is pretty amazing. So, on the second efficacy measurement, we see good results. Long-term patient satisfaction, 4th indicator. Nearly 80% of patients were satisfied. There are about 10 to 15% of the patients who were neutral at 24 months, and less than 10% of patients who are unsatisfied. And this varies by patient, but there are some patients that over time will lose the memory of having the hyperhidrosis and say, it was okay. And what they don't really indicate is that they're sweat-free here. So safety, I think the biggest question is when patients come in is, doc, what are the issues that I should be worried about with this treatment? It sounds kind of strange to burn out my sweat glands. What's the safety? So what we talk about are some different things. 41 treatment-related adverse effects occurred in 18 subjects. Now, does that mean that there are 41 complications? Well, if we look at what we're talking about, they fall into several different categories. One of them is altered sensation in the area, typically in the area that we treat. And what I've seen in my practice, and we've treated over 100 patients in the last year, we see that typically in the underarm, we'll see less ticklishness, less sensitivity. I have not seen any paresthesias, dysesthesias, or complete numbness in any other part of the limb. So most patients say, I maybe, if I think about it, I'm a little less sensitive under there, but for most patients, that's not an issue. And most of the time, that resolves at 3 to 6 months. Edema is probably the most common issue that we see, and it occurs in more active patients, I believe. Several of our patients live very active lifestyles, very active jobs, postal delivery, workout, fitness trainers, and things like that. We typically see a little bit more swelling in those patients. Again, self-limited, usually resolving within a few days. At most, the longest duration that I've seen in my personal experience is a week and a half of edema. Skin rash, irritation, dermatitis, very few patients, maybe one or two patients I've seen. An increase in underarm odor I have not seen, so that's an interesting factor there. Pain, almost all my patients, I recommend Motrin or Advil or another type of NSAID that agrees with them for 24 hours. Typically, after 24 hours, nothing is needed. So as you can see, these post-op adverse events are pretty self-limited and for the most part, relatively benign. I think one of the things that lasts a little bit longer than some other post-op issues is some bumps under the skin, which can last for about 3 weeks to 4 weeks, especially at higher treatment levels. But for the most part, when patients return for the second treatment, if they have them, they're almost always gone. The patients can expect a lasting result. Sweat glands are destroyed and do not regenerate, and we typically track our patients for about 12 months. Clinical studies show an average 82% sweat reduction, and that's what we quote patients. We tell patients that we may not eliminate every bead of sweat, but we'll be able to eliminate almost 80%, and for the most part, we can eliminate more in some patients with a little bit higher treatment level. I often tell patients to get almost 100%, we have to run a little bit more of a risk of bumps under the skin that, again, are temporary and self-limited. But in those patients that want absolute 100% sweat reduction, they often find that that's a small side effect for eliminating something that's plagued them or bothered them for most of their life. The results are immediate, and this is one of the greatest things about miraDry is that the next day the sweating is gone. And that's almost mind-blowing to these patients who have endured years of embarrassment and having to change shirts between job shifts and things like that. So having a patient wake up the next day without a problem that they've endured with for decades is one of those things that sets you apart as a physician. With a relatively short procedure, you have incredibly life-changing events. The downtime is minimal. Most patients can return to their daily activity that evening. I do caution patients against rigorous exercise for 48 hours to minimize the amount of edema. Almost all patients will have some edema. And to help that, we often recommend ice packs. We apply them immediately after the treatment, and we recommend 15 minutes on, 15 minutes off as needed for the next 12 to 24 hours. With that, we've gotten very few patients complaining of long-term swelling. The diagnosis criteria for hyperhidrosis is interesting because there isn't a quantitative test for that, but it's more of a qualitative type of diagnosis. And in the sense that for the two different diagnosis criteria, when we look at the formal consensus criteria of the multi-specialty working group on the recognition, diagnosis, and treatment of hyperhidrosis, it's a long name, but basically what they came up with is that if you have focal, visible, excessive sweating for greater than 6 months without any apparent cause, pheochromocytoma, some type of adrenal issue, and lifestyle, and the patient has two of the following: bilateral and symmetric, something that impairs daily activity or greater than one episode per week, less than 25 years of age, family history, cessation during sleep. They fit the criteria for hyperhidrosis. The other diagnosis scale or inclusion criteria is the hyperhidrosis disease severity scale. And this is where I find that most of my patients can really, qualify themselves. And so if a patient says, well, my sweating is never noticeable and never interferes with my daily activities, well, I wouldn't think that they're a candidate for this sort of treatment. However, I believe that patients who are 2, 3, or 4 on this scale are candidates. So if sweating is tolerable but sometimes interferes with daily activities, that may be an indication of a sweat-bothered patient. For instance, I have treated an attorney who said that I like to take my jacket off during courtroom cross-examining, and I'm afraid to do so when I'm doing my cross-examining because I sweat. He goes, it doesn't happen often, but when I'm doing it, I don't feel comfortable. So for that patient, the miraDry treatment was something that he sought out, and he would be falling into the sweat-bothered category, which I think is a great opportunity for this device. So I believe that in my practice, we look for patients who are both hyperhidrosis patients, but also we look for those patients who want to change their lifestyle and not have to, A, wear deodorant, B, worry about stressful situations, or C, just eliminate something that is unpleasant altogether, underarm sweat. So above the number 2, 3 is my sweating is barely tolerable and frequently interferes with my daily activities. That's an obvious, easy patient to convert. And 4 is really the no-brainer. It's sweating that's intolerable and always interferes with daily activities. So I think this is a great way of screening patients. On my intake forms for my office, I often ask, are you bothered by your underarm sweat, as part of a number of different things that we screen for in trying to find patients that, may benefit from this sort of treatment. So the patients exist in your practice already, and I would think about, about 20% of my patients are already existing within the practice, and 80% come from outside. So patients will find you. Your own patients will find the treatment within your practice. The treatment is extremely simple. It's almost paint by numbers. As we can see here, we have a marking paper which provides a transfer tattoo, almost like an old Cracker Jack tattoo. You apply it to the skin, apply some rubbing alcohol to the back of it, peel the paper back, and you get almost like a football grid in which you're able to anesthetize the armpit. So the treatment requires local anesthetic, 1% lidocaine with 1 to 100,000 epinephrine in small subdermal wheels, and we use a mesotherapy needle, a 30-gauge needle, to provide good localization of the area without significant discomfort. Almost all the patients who come in who are needle phobic say afterwards, that wasn't really that bad. And surprisingly, the underarm isn't as sensitive as other areas of the body. We often think of it as that, but after the first few injections, most patients can tolerate it quite well. And so we go through an area, we block the area, and the treatment is performed with the miraDry device. And you can see it here. It has a suction cup. It has an indicator up here of the area or the number in the grid that you're at. And it may be 1, 2, or 3 treatments per longitudinal line. And over here, we can see the treatment bar, and this is the activation button. It typically takes about 60 to 90 minutes for consultation and treatment. And for women, the treatment area obviously is a little bit smaller. It can take anywhere from 30 to 45 minutes. I do all the treatments myself. I like the hands-on aspect of this. It allows me time to interact with my patient. It allows me hands-on time with the device. And my experience is my own, so that when I speak about this from a first-hand point of view. However, the device is extremely simple to delegate. It's one of those things that's, again, almost like paint by numbers and can be delegated to an RN, PA, or NP in your state as applicable. And you'll have to check with your state medical board and your state licensing board to determine whether or not this is able to be delegated in your particular state. Again, patient treatment satisfaction is extremely high. My personal experience, I've been treating patients for almost 16 months. I've had no major adverse effects. Again, I think the longest term side effect that we've seen has been some bumps under the skin, which have lasted in duration for about 3 to 4 weeks, and that's typically resolved. Almost all patients get some minor post-treatment swelling, which lasts for 1 to 3 days. So my miraDry patient makeup is about 60% male, which is an interesting factor, and 40% female. Now, I'm not sure what that means. I think that men are more aggressive in trying to find definitive treatments, and I think that when they do find miraDry, I think the barrier for them to enter the miraDry treatment cycle is lower. However, I think that women are probably equal, but we just looked at our numbers and kind of skewed a little bit towards the men. Our age range is 18 to 60. The indications are for 18 years and older. And again, it's about 20% of my current patients, and we offer some literature in the office. We have a patient education loop that we play in the waiting area, which gets a lot of interest from patients. And we look for patients through screening modalities such as intake forms. But one of the easiest ways to find a hyperhidrosis patient is when you shake hands with your patients if they have sweaty palms. Oftentimes, hyperhidrosis of the hands also indicates hyperhidrosis of the axilla. Not always, but there's a good way of screening there. Currently, there is not an FDA indication for hyperhidrosis of the hands. I would caution against clinicians trying to use this device at this time. That technology may be in development in the future. I can't comment on that, but I think that that's something that I've been asking for that I think would be an extreme benefit to patients. So patient motivations can range from I don't like my sweat to I cannot tolerate and live anymore sweating like this. So there's a spectrum. I have a patient experience here that's very interesting I'd like to share. And this was posted on one of the review websites. And it really speaks to how hyperhidrosis patients suffer almost silently. And we're looking for patients like that to help. Because as part of being a physician, one of the best parts or one of the cores of being a physician is to rescue patients from whether it's a disease or a condition or misfortune. And, you know, when you do that, it creates a lot of satisfaction and put that satisfaction back into our jobs that I think so many practices suffer from. So with this patient experience, it says, I suffered for a long time from stinky underarms. I couldn't stand my own underarm smell and didn't know why they stunk so badly. I tried every deodorant you can name, even deodorant from another country. Nothing worked. I had to apologize to people in advance for the smell just in case I started sweating. No matter the temperature, hot or cold, I always sweated under my arms. I had to throw away a lot of my favorite shirts because the armpits were worn out and discolored. You know, dry cleaners are a great way to advertise, I think. We haven't tried it yet, but I think that on most hangers you can buy a little bit of space for your practice. And I think it would be a good thing that if you put a little tag or on those hangers, you know, for patients who are tired of throwing their shirts out, that would be a good way of getting the word out. Now, continue on. In school, I was teased with nicknames like Sad Pitts instead of Brad Pitt, Funk Master Flex, Pit Stop, etc. It's funny now, but it wasn't so funny when I was a kid. So a patient goes on to talk about the treatment, and you can see that this is really a life-altering sort of problem. You know, it's a subject of ridicule, and you know, it ostracizes patients from their peer group. So after numbing my pits, he started the actual procedure, which didn't take long. I noticed immediate results, not one bead of sweat, no smell at all. My pits went from smelling like I had 2 skunks in a headlock to no smell at all. The technology is amazing. So here the patient is selling the device on a forum to other patients. And day 2, still no sweat and odor. I went to my date's house, couldn't smell my underarms. I asked him what they smelled like, and he said they didn't smell like anything, no odor at all. This is a life-changing thing. And then the patient further goes on to sell the treatment for you. And I think this is what, after somebody asked, how much did it cost? And the patient says, well, the price was listed for 2 treatments. You'll do the second treatment at 3 months afterwards. My first treatment, I have 100% sweat and odor reduction so far. I mean, we love patients like this. We love experiences like this. So my patients come from the current patients. We talked about this. We try to treat all our staff so that they become ambassadors for the brand. And we look at acquiring new patients through word of mouth, through our website, and the miraDry physician locator. And we've actually brought the device onto our local TV, which generated a good amount of interest. We've advertised in gyms, and we continue to see growth within the practice. We see here the posters that indicate all the different types of patients that could be potential candidates, and each of these vignetted stories here basically says why each of these patients chose miraDry. And our check-in desk is right here. This is a little separate waiting area, and patients can have an opportunity to see these posters. Our website goes into miraDry a little bit more extensively. We have a YouTube channel where we actually show off some of the technology. So if you ask me, was miraDry a good investment? I think absolutely. The cost for the system is, I think, right where we wanted it to be. The treatment heads, while they're disposable, aren't excessively expensive. We purchased the system in June 2012. We paid it off in 6 months. And obviously the range has increased. So initially, you know, like any other device, there's a ramping up stage. If you have a large patient database, we're a relatively young practice, so we grew organically. And right now we're averaging about 10 treatments a month, and revenue per treatment is about $1,250. It becomes a new base for other aesthetic procedures. I can't tell you how many patients I've converted into injectable patients, into laser skin resurfacing patients, into a breast aug patient, into facelift patients, just by spending that 30 minutes, 45 minutes doing the treatment, sitting there and talking to the patient. It's a high conversion to treatment. Again, very few patients walk out of the office who come in consulting for miraDry without getting the treatment. And thus, I think it's an excellent investment. There's some new clinical data on odor reduction, which I think is an excellent use for this treatment. The definition of odor is osmidrosis, or also it's called bromhidrosis. It's the secretion of foul-smelling sweat or perspiration. So in the U.S., it's a $2.7 billion industry. And so if we can only take a small part of that, we're doing pretty good. If we look at the anatomy of the axillary sweat glands, we can see the eccrine sweat glands and the apocrine sweat glands, which are the waxy glands that have the odor to them. And so both of them are effectively treated. Just move on here. The data for odor reduction, while it's not FDA indicated, the studies are there. And this is an interesting way of reporting it. The physician sniff test, but the subject reported scale is probably a little bit more accurate. So patients do indicate that they have a reduction in odor. Again, multiple efficacy measures, and for odor, it's patient self-reported. Odor reduction results, 2-year data, almost 90% reduction of odor. So only about 11% indicated that they had odor at 2 years, which is a pretty good treatment. I think it's more than pretty good. I think that's an outstanding treatment, I should say. So highly effective, simple, straightforward procedure, happy patients, good word of mouth, an excellent investment. So miraDry's worked for me. I think it opens up a world of treatment that we never really thought about 2 or 3 years ago. We had Botox treatments for hyperhidrosis. We still do Botox for palmar hyperhidrosis. It's a niche that can be exploited in many markets because there's patients in every single market. And it doesn't matter if you're in a cold or hot environment, if you're a seasonal environment, every single hyperhidrosis patient will tell you they sweat no matter what the temperature is. For those who are sweat bothered, that's our biggest area in which we're trying to drive growth. And I think we'll see that odor and sweat will become something like hair and aging. These are things that we can choose to not have and can live without. So at this time, I'll take some questions, and we'll go to the panel.
Dr. Khorsandi, thank you very much for that thorough and interesting presentation. We do have some questions from the audience, so I will read a few to you. The first question is, how do you determine the energy level you use?
I think that's an interesting question. The device has 5 different treatment levels, 1 through 5, and the treatment level varies by how long the duration of the microwave energy is delivered to each particular area. So at a level 5, we're treating for a longer period of time, thus creating more thermal energy, creating more glandular destruction. I treat almost all my patients at a level 3 to start, unless they're severe hyperhidrosis patients where they say they're sweating all the time every day, and I may treat them at a 5. I talk to patients about efficacy, and I say that they should expect an 80% reduction with 2 treatments at a level 3. If patients are satisfied with that, then that's where we treat them. If they believe that they need a higher level of treatment, I talk to them about the risk of subdermal bumps and skin irregularities, which I think occur at a higher level. And if they're okay with tolerating that for a short period of time, including some hair loss, which I think is a benefit for most patients, then we treat them at a level 5. There are a few patients, in fact, I have 2 patients in my practice which we've treated for a 3rd time who wanted additional sweat reduction. So it really depends on the patient, their tolerance for the potential side effects, but I believe at a level 3 we can treat most patients.
Thank you. We have another question. What are some of the key points to cover in your patient consultation?
I think that some of the key points are, discussing how long they've been suffering with hyperhidrosis, what they've tried, and I think most importantly, there's a fear that the patients have of this being some sort of detriment to their body. I tell them that we have over 4 million sweat glands in the body, only 2% reside in the axilla, and that the reduction of sweat in this area would be tolerable and would not be an issue. So I think most of the concerns when patients come in for consultation are for the side effects, and I think we focus that consultation on explaining those to the patients and understanding that the benefit that they'll have will be significant.
Thank you. Another question, how do you charge for the procedure?
We charge patients per treatment. We have a 2-treatment protocol, and we oftentimes charge them for both at the same time. We charge $1,500 per treatment and package it at $3,000. Occasionally we'll have a 10% discount, certain specials that we're running, but that's very rare.
Okay. One other question, who does the procedure at your practice?
I do all the procedures myself. Again, I like to have a hands-on experience with the device. I like to develop an expertise in my own hands so that we can work towards developing other applications for the miraDry. So it can easily be handed off to a licensed practitioner, but again, it depends on your state jurisdiction.
Thank you, Dr. Khorsandi. I think that is the questions that we have. And we're getting to the end of our seminar time, so we'd like to thank you all for attending this presentation, and we hope you found it interesting and informative. I would like to thank Dr. Khorsandi for your time and valuable information. The seminar has also been recorded, and the presentation will be hosted on miraDry.com. Go to miraDry.com and go to the physician's website and look under web seminars. Thank you again for your time, and good night. Thank you, Dr. Khorsandi.
Thank you, Lori. Have a good night.
Thank you.